Lani Fan. I'm a student nurse. I'm going to go ahead and do a neuro assessment on you today. So before I start, I'm going to go ahead and ask you a few questions to test your long-term memory. Who is the current president of this term?
Joe Biden.
Very good. And to test your short-term memory, what did you have for breakfast today?
Eggs.
Very good. I'm going to give you 3 words. I'm going to have you go ahead and repeat them later. Board, marker, red. Okay? Now I'm going to test your cognitive function. I'm going to have you count down from 100 by 7.
100, 93, 86, 79.
Very good. Now go ahead and repeat those 3 words I gave you earlier.
Red, board, marker.
Very good. Okay, now I'm going to go ahead and test your cranial nerves. So to start, I'm going to have you close your eyes and test cranial nerve number 1, which is olfactory. Okay, I'm going to give him this alcohol swab and tell me what you smell.
Alcohol.
Very good. Okay, I'm going to test cranial nerve number 2, which is optic. I'm going to use the Snellen chart here. Have you cover your right eye. Okay, have you read the smallest line as possible.
TOZ.
Very good. Switch to the other side.
TOZ.
Very good. No hands.
TOZ.
Very good. Okay, now I'm going to test your peripheral vision. I'm going to have you go ahead and cover your right eye. Okay, and then tell me when you see my fingers.
See it. See it. See it. See it.
Okay, now the other side.
See it. Sorry, see it. See it. See it.
Very good. Okay, now I'm going to go ahead and test cranial nerve number 3, 4, and 6, which is the ocular motor, trochlear, and abducens. I'm going to go ahead and have you follow with your eyes, but with not your head. Okay, follow my pen light.
I was going to ask you if you could do it.
No, I don't think we can share it. Why?
Very good. Now I'm going to see your eye reaction to light. So I'll have you go just stare straight at me. Very good. So both eyes are equal and reactive to light and accommodating. Now I'm going to test for convergence. Go ahead and stare straight at the pen light as it gets closer. Very good. Now I'm going to test cranial nerve number 5, which is trigeminal. I'm going to test your facial sensation. I'm going to have you close your eyes and tell me where you feel anything on your face, okay?
Left forehead. Right forehead. Right cheek. Left cheek. Left chin. Right chin.
Very good. Now I'm going to test cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus. And I'm going to test for the gag reflex. At this point, I would put the tongue depressor near the back of his mouth and see if he gags. And then, yep, he does it. And then I'm going to go ahead, test cranial nerve number 7, which is facial nerve. So I'm going to have you do a few expressions for me. Go ahead and smile, frown, puff your cheeks, and raise your brows. Very good. And now I'm going to test all those for the cranial nerve 5, 9, 10, and 7 with having him going to taste this food and then chew and swallow. Okay, he picked up a sunflower seed, salted sunflower seed. Okay, and what do you taste?
Salty.
Very good. And I see him chewing and I see him swallowing. Very good. Okay, and now I'm going to test cranial nerve number 8, which is acoustic. Go ahead and close your eyes and tell me which side of you hear anything from.
Left. Right.
Very good. Okay, now I'm going to test cranial nerve number 11, which is accessory. I'm going to put some resistance against his shoulder. Go ahead and shrug. Very good. And I'm going to have you turn your head to the side toward my hand. Good. And to the other side. Very good. Okay, now I'm going to test cranial nerve number 12, which is hypoglossal. I'm going to have you stick your tongue out and then go ahead and move it left to right. Very good. Okay, now I'm going to test your motor function. So first I'm going to test your upper motor function. Go ahead and do a bicep flex for me. Okay, that tests C5 and C6, and then bicep extension. That tests C7. And I'll have you go ahead and stand up right here. I'm going to have you kick with your right foot, and then kick with your left foot. And then that tests knee flexion, knee extension, which is L4, L5, and L3. Okay, now I'm going to test your sensory function. I'm going to have you close your eyes and tell me, identify where you feel anything, okay?
I just submitted.
Right shoulder.
Oh no, what
Left
I'll do
shoulder.
is I'll copy it and paste it on a Word doc.
Neck.
We
Right,
like
left,
put a Google
back
Doc,
shoulder.
and we each have one.
Right back shoulder.
Very good. Okay,
Right thigh. Left thigh. Left knee.
Very good. Okay. Now I'm going to go ahead and test your reflex. Go ahead and dangle and relax your legs.
You can go, you know, Karen,
Okay.
put it together and just separate.
Oh, yeah.
Very good. Okay, now I'm going to lastly test your cerebellar function. First, your balance. I'm going to have you stand here. Go ahead and walk towards me from heel to toe. Very good. Good balance. Gonna have a seat. Now, lastly, I'm going to test your coordination. And then I'm going to go ahead and have you point from your nose to my finger each time I move it, okay?
Yeah, the weight room was so sweet. Like, she was.
Literally, like, V was like giving her S bar, B leave, and she was like,
Like, she was very